So today's topic is based on B scan imaging of orbit. ठीक है? So I'm sure some of you might be having this as your thesis topic also, and it's a really cool thing, Actually, if you get a little bit hang over this, it becomes really interesting, and there are a lot of pathologies that you can diagnose, using B scan. So what actually happened during my PG time was that the B-scan machinery of the ophthal department, it was not working for some period of few months or so. And then they used to send every single patient, cataract patient, and a lot of requisitions we started getting. So it was a bit annoying in the starting, but within a few days, we got a hang over it. We read, we researched, we asked our seniors. And then once we started doing these B scans, a lot of B scans, actually, one of my juniors took this as his thesis topic also and did a wonderful study. So then we discovered so many different pathologies on B scan, may it trauma related, may it be cataractus lens, may it be different types of detachments, retinal detachment, so many choroid detachments, vitreous detachment, vitreous hemorrhage, and whatnot. So there is a lot of awesome things, and let's start our lecture on this note. So this lecture will be, I will be discussing all the important things about this particular modality, including its indications. Okay. After that comes technique. How are we going to perform this? Then comes the normal anatomy, which is paramount, because if we are not very confident about the anatomy, then we'll not be able to interpret the findings correctly. And then comes interpretation of common findings and pathologies. Okay. Right. So what is the importance of B-scan ultrasound? So number one is that it is going to be non-invasive. So B-scan ultrasound requires no needles, no injections, minimizing the discomfort, no contrast, as well as no radiation exposure. Okay, so if you get any time, any long question in exam about any modality, you can always spare at least one paragraph and few points in which you can write about the advantages of that modality and how it is better than the other relevant modalities. Then comes real time. Yes, dynamic examination, very important. इसमें you get live images allowing for dynamic assessment of various structures. We can ask the patient to do certain ocular movements for that, and we can differentiate whether it is a particular type of detachment or the other one. Then comes, of course, radiation free. Okay, simple. Okay, so what are some common indications of B scan ultrasound in our practice? Starting with your media opacities, such as cataract, corneal opacities. We can look at various types of vitreous, whether it's vitreous hemorrhage, whether it is vitreous detachment, whether it is asteroid hylosis, and other things as well. फिर दूसरा आ जाएगा intraocular tumors. तो इसमें we can have common tumors which can come in our practice, especially if you're dealing with pediatric. So we can have retinoblastoma cases. We can see some melanomas or hemangiomas, metastasis, nevi, and other intraocular tumors. Then comes retinal and choroid disorders. So इसमें आ जाएगा detachment and retinochrosis. Okay, detachment, I'm telling you, this is one of the most important. Okay, so it is sometimes it can give you some pain in your practice, but I'm going to give you some some cheat codes that how you can confidently say कि ये retinal detachment है or is it choroid. And I have seen a few cases you won't believe जिसमें all three types of detachments were there, plus the patient was having this IOL also. So there was pseudophakia also, a lot of reverberation artifact. But still, we tried and tried. We tried focusing multiple times, and then we could detect all three types of detachments. Then comes ocular trauma. So ocular trauma may we can have globe ruptures, foreign bodies, you have to report foreign bodies, and lens dislocations. Okay. So this is your basic, just at a glance, what are the indications of B scan. फिर क्या आ जाएगा? Vitreous and optic nerve abnormalities. ठीक है? Vitreous and optic nerve abnormalities. Good evening, achiever. We are just starting. We have only done the indications. You have not missed anything. So indications में, if we talk about vitreous and optic nerve abnormalities, क्या क्या हो सकता है vitreous में? It can be either hemorrhage, asteroid hylosis, and ophthalmitis with a component of vitritis, of course. ठीक है. And then comes papilledema and optic disc abnormalities such as optic nerve drusense. And apart from that, in cases of increased intraocular pressures also, you can measure the optic nerve diameter near the optic head region. And we might also be able to comment on some kind of posterior scleral indentation, though MRI or CT remains a better modality about the when it comes to commenting on these things. ठीक है. Up next हमारा आ जाएगा what are the contraindications. So if I talk about, can you guys just tell me, चलो let's keep it a bit interactive, so we'll gain much more from this lecture. ठीक है. So can you tell me some contraindications in which patients you will refrain from doing a B scan ultrasound? Whenever there is suspected globe rupture, because इसमें क्या होगा कि अगर आपने pressure किया थोड़ा भी, it might be mild transducer pressure, but that might also lead to frank rupture and extrusion of the ocular contents because of your transducer pressure. So if there is a suspected globe rupture, in those cases you don't have to do this. And also a lot of times, ultrasound is not the best modality for certain things. For example, if there is trauma, intraocular foreign body, so CT will give you much higher resolution and confidence in diagnosing. Similarly, when it comes to pathologies of optic nerve, extraocular muscles, and those things, so MRI is going to be much more handy to comment upon these particular things. Okay. So indications हो गया, contraindications हो गया. Moving next to patient preparation and positioning. So this is very important because अगर अच्छा patient preparation है, so we will get better results and we will be diagnosing and picking up more things. तो इसमें important है एक तो supine position में everyone knows, I hope. Patient lies on their back and eyelids need to be closed without a doubt. अच्छा, gel application की बात करें तो in other places you might be working in maybe some resource depleted areas, so you might be trying to save on your gel, but ocular ultrasound में and certain MSK and superficial ultrasounds, in cases में I am giving you this lifetime advice कि gel application में don't have to fear away from applying lots and lots of liberal amount of gel, because that will give you a better contact. You don't have to apply that much of transducer pressure, and also the image quality is going to be much better. ठीक है, so gel बहुत सारा लगाना है इसमें. Then contact lens, if the patient is wearing contact lens, you have to instruct them to remove them before, because they will interfere with the ultrasound wave transmission. Now comes eye movements. तो इसमें ये important है that patient is instructed to move their eyes during scanning. However, you have to clearly give instructions before starting your ultrasound. ठीक है, ये नहीं कि द पेशेंट्स आईज आर क्लोज एंड देन यू आर सेइंग ऊपर करो, नीचे करो, दीवार को देखो, फैन को देखो, नथिंग लाइक दैट. बिफोर itself you have to properly give 2 minutes, explain to them that when I will say that you have to look up, that means you have to look at the wall which is just behind. If I have to say you have to move your eyes 360 degree, to just rotate. Another important thing is that don't move your neck, don't move your face. Your neck should be still, and only your eyes should be moving within your sockets. So ये सारे instructions, the different types of movements that they have to do, whether sideways, ऊपर नीचे, or 360 degree rotatory movements, everything should be instructed well before asking them to close the. Yeah. Now comes ultrasound technique and probe selection. ठीक है? High frequency transducers, everyone knows this without a doubt. So what is the usual frequency? It is anywhere from 7.5 to 30 megahertz for optimal resolution of superficial structures. And also we have to look at the deeper structures such as the posterior segment, the vitreous, the disc, all of those things. फिर आ जाएगा B mode imaging, that is grayscale, primary modality used for structures का visualization. After B mode, then you can always apply some color Doppler. So save it for next step में color Doppler. Axial में and sag में, always you have to see in two planes. So एक short axis में, and then you have to also hold your probe longitudinally, axial as well as sagittal. ठीक है, so I hope everyone is fine with this. चलो, now we are going to show you a visual illustration. तो इसमें we can see कि eyes closed हैं, patient is lying supine, the neck and the face should not be moving, only अंदर ही अंदर eyes have to move, and a lot of generous amount of jelly has been applied. So this, you are holding it in the short axis, and then you can rotate it 90 degree also.